Hello, my name is Michael Geary. I'm a registered nurse currently enrolled at Eastern Kentucky University in the Psychiatric Mental Health Nurse Practitioner Program. My proposed intervention project is psychiatric care gaps in patients under age 25. The problem: psychiatric care for people under the age of 25 is challenging because resources can be lacking as young adults transition from child-adolescent mental health systems to the adult mental health system. Care and medication gaps can be detrimental in the care and treatment of young adults with mental illness, which in turn puts a financial and physical strain on emergency medical care for treatment. Background and significance: loss of insurance eligibility, either private or government funded, can cause loss of care, which not only affects their caregiver's ability to assist the young adult, but also affects medication reimbursement for the continuing care of their mental illness. Over a 3-year study, it was found that 85% of 18-year-old Medicaid patients had let their insurance lapse. The transition from child Medicaid eligibility to the narrower adult eligibility categories may also cause loss of Medicaid. Slade, 2014. Another issue that occurs is the change in caregivers as the young adult transitions from child-adolescent mental health to adult mental health. Caregivers usually specialize within a specific age group. Therefore, they do not continue care for the young adult, and the new caregiver must be found. These gaps can be detrimental in the care and treatment of the young adult with mental illness, causing loss of care and loss of medications needed to maintain their mental health. The method of the study: approximately 50 patients with previously diagnosed mental illness between the ages of 18 and 25 will be involved in the study. Included participants will be chosen based on if they had a previously diagnosed mental illness, if they are currently not receiving mental health care, or currently on medication. Only those who meet all 3 inclusion criteria will be allowed to participate in the study. The study will take place at 2 outpatient clinics that have agreed to provide free office space. Medication will be available at a reduced cost at the clinic's pharmacy. Patients will receive free initial evaluations, follow-up evaluations during the course of the study. The clinics have agreed to provide student psychiatric nurse practitioners to oversee the evaluations as part of their clinical hours. The group will be interviewed at the beginning of the study to identify issues and concerns with their current care needs for both medication and care, along with the severity of their mental illness and diagnosis. The group will be followed on a biweekly basis face-to-face meetings or, if necessary, telemed. This study psychiatric nurse will assist with ensuring that care and medications continue throughout the study. A social worker will be used as a needed basis to assist with issues surrounding care resources and aid in assisting with mental health care needs or assisting with access to medications. The total study will take place for approximately 19 months, with data collection occurring for over 1 calendar year. The implications. The goal of the study is to improve the young adult's transition into adult psychiatric care with decreased gaps in care and continued medications. With the decreased gaps in mental health care and medication lapses, there should be a direct decrease in emergency health care needs, decrease in use of alcohol and illicit drugs for self-medication, decrease in suicide attempts and suicide rates, and a decrease in homelessness. If the study proves to be successful, the financial strain on the healthcare system will be lessened. The volunteers will benefit from improved mental health and self-value. In summary, this study, if successful, can lead to healthier young adult mental health, a younger, healthier adult community that in turn would lessen the current strain placed on health care because of the lack of available and utilized resources. The results of this study, I believe, would show the benefit, would closely assisting the young adults, would truly help lower the overall costs and improve their care and meet their needs. I'd like to thank everybody and have a great evening.